Hey everybody, it's HillsidePrepper552, and today we're going to be talking about medical preparedness. So some of the key things that we need to talk about with medical preparedness is not only equipment, but knowledge as well. So we're going to get right into it. The first thing I really want to talk about is the first aid training. So in my experience, being in the criminal justice system, being a first responder, and also being a volunteer for the ambulance at one point, one of the big things that you need to have is first aid training, and that incorporates not only CPR but incorporates things such as what do you do if you have someone who has a broken arm? Do you splint it? What do you do with that? Burns, anything you can really think of. There's a lot of agencies across the United States that really do first aid and CPR training. The American Heart Association, the Red Cross are two big ones I can think of. One that I have utilized recently is the National CPR Foundation. And I've done that online just because of all this pandemic stuff. It's hard to get into one of those training sessions with all the restrictions due to COVID-19 and so on and so forth. So, you can learn anything online. And just, for just disclaimer for this video, so no one takes anything the wrong way, I am not a medical professional. I am also not a certified trainer in any aspect that has anything to do with medical. My background with this stuff is mostly what I've been trained in it and my experiences with it as well. So some of the things when I was going through an academy a few years ago, we had to take what was known as certified first responder training. It was basically like EMT without being an EMT. It allowed you to do a lot of the same basic things like take blood pressure, measure someone's pulse, measure their breathing rates, and you got to do a little bit more with stuff. They always talk about scene safety. They talk about checking someone's airway, whether they're breathing, the ABCs, checking heart rates, checking pulses, everything of that nature. And you basically do that with first aid and CPR, you know, classes as well. With the first aid and CPR, though, the biggest thing they want you to learn from CPR is, CPR is cardiopulmonary resuscitation. What does that mean? Well, if you got someone who's on the ground who's not awake, he's unconscious, you can't feel a pulse, and he's not breathing, then you got to do CPR. And with CPR, it's different because you see it on TV, but when you do it in real life, it's a whole different thing. You have the AEDs, you have a lot of people around. Generally speaking, you have people taking turns, one doing compressions, the other one's doing the airway breathing. And we'll get into equipment for that, because there is equipment you can use that's like a barrier for safety for you and the patient. So discussing all those different types of things, it's good to have medical training and first aid training, especially in today's world and with preparedness, because if disaster strikes, are you going to be able to get medical attention right away if you need it? Probably not sometimes, because if you look at some instances like Hurricane Katrina and the hurricane down in Florida, which I mentioned it yesterday, but the one with the nursing home where all the staff residents or the staff left the residents in there basically to cook alive, what are you going to do in those circumstances when the government is unable to help you? You're kind of on your own. And if you're in a situation where it's like The Walking Dead, if anyone watches that TV show where it's a complete breakdown of society, it is the apocalypse. You have zombies running around. Not that that scenario is probably going to happen anyway, but if you're in a group with somebody and someone has a medical emergency, can you get antibiotics if you have an infection? Can you get enough gauze and bandages if there's a deep cut? If you have a doctor, are they able to do stitches? There's not going to be sterile environments. If someone does go unconscious, do you know how to do CPR? Even then, in a situation like The Walking Dead, doing CPR, you have to have them go to a hospital to get stabilized and see what caused it, whether it's a traumatic injury, if they got heart disease or any other kind of issues. And if you don't have those types of things, it's very hard to maintain and stabilize somebody. But basic first aid training and basic CPR will help you a lot in the long run, just because it helps you deal with certain different things. And I'm working off a new tablet today to help keep me on topic a little bit. That's the problem. I used to have old videos. So, well, we could talk about some of the equipment. And for me, with the position that I hold, as well as being, a prepper at this point, I keep all my medical supplies in a toolbox. Basically, I bought a new toolbox for my ever expanding collection of hand tools and power tools. So my old toolbox, which was a Stanley one I got from Tractor Supply, holds a lot of my medical supplies. So just kind of briefly talk about different ones here, all the different equipment. So something you really got to think about is always keeping something that's going to stop the bleeding in. These are simple bandages for basic cuts. You combine that with, your triple antibiotic ointment cream, especially if you come into contact with something that's dirty. It helps keep out bacteria and other types of things. So, it's basic scratches, cuts, whatever. When you get in the bigger things, if you have a lot of gauze and you need to keep pressure and you need to wrap some, you have wrap on there. And again, gauze pads as well. Those are important. Now, you get in a situation where you need to, remove somebody's clothing. You got to have scissors as well. And really, what doesn't hurt to get is one of these first aid kits. This is a very small one. This is one I got on Amazon, I think, for like $20, and it's got a whole bunch of everything I just mentioned. It's got bandages, different types of bandages in it. It's got sterile ones. It has scissors. It has tape. It has gloves, I believe, in it. I think it has a plastic one-way CPR mask, I do believe. Sting relief. A lot more bandages. This one is gloves, scissors, tape, a whistle. So a whistle is good to have in medical emergencies if you need a signal for help. Because again, in a grid down situation, how are you gonna call for help? You can't call 911 if there's no cell phone service or the landlines are down or whatever. If we're in total grid down situations and you are near other people, you got to figure out how to get their attention. So having one of these is good. Other ways to stop bleeding too, this is important, are these tourniquets here. So a lot of ambulances and police departments, fire departments now carry tourniquets, but anybody can really get them online. So really how it works is, first you undo this because it's tightly secure. These tourniquets though, once you remove them, the purpose for them is to stop major bleeding, especially on a limb. So like if you got a cut like right here on your arm and it's really deep and it's bleeding and you're worried about someone who's going to bleed out, lose blood volume, a tourniquet could really stop that. So what you would do is you take the tourniquet, and one of these mechanical ones is awesome because you can just put someone's arm through the insert and then you just twist this around until it's tight enough where you can see the blood flow stopping. And what's nice about these is you can mark the time you put the tourniquet on. If we're in a not grid down situation where it's just a large natural disaster, but you can still get someone to the hospital, it's important to have the timing that you put the tourniquet on, because that's all important for different types of things, for surgery as well as trying to save someone's limb or if they have to think about amputation. So there's that. There's a rubber one as well, and a lot of people don't even think about it really, but one tool that a lot of people wear, they don't even think about it every day, if I can get it. Men and women both use this a lot, is a belt. Belt can be used as a tourniquet. Think about it. You got the holes in there. You can wrap this tightly around. It's supposed to be 2 inches above or below the wound. So let's say it's here. You could wrap it here. Well, you want to try to keep away from the joint so you can. So probably a better one would be if it's here. You want to go above the joint and then just tighten it down. So that's important to have. Those tourniquets. Men, women, everybody wears belts pretty much nowadays. If you don't have access to tourniquets, it's a one quick thing to grab, and it's very effective to use. Now, one of the things I didn't talk about is with burns. If you get someone who's got major burns, especially second and third degree burns, the major thing that you're worried about losing is body heat. So you have to have some kind of blanket. This is a good reflective blanket. It's supposed to keep 90% of radiated body heat in, because you're preventing both hypothermia and shock. Shock doesn't just come with blood loss. It comes with, having a lot of your body burn up. And I don't remember, but they assign percentages per certain parts of your body. So like, I think your legs are like 9%. I don't remember what the exact percentages is. That's something I'd have to look up, but you know, that's something you have to consider. And then the last thing we were talking about that was basically part of the first thing we were talking about is CPR masks. So these are one-way CPR masks. They let oxygen go in, but nothing comes back out. This is to protect you, and this is to protect your patient. So basically, you have one of these. If I can get it open. So you just basically put it over the mouth, and there's a little like blow piece in there, and you blow air into it. And how you do, breathing for adults and children is a lot different for how you do it with infants. So what they teach you is the mask goes over the nose and mouth, and you would generally kind of pinch the mask shut down here and here once you establish the airway to make sure that oxygen isn't getting out, because you got to have pressure for the air to get into the lungs. But with babies, generally speaking, it's the same concept, except you don't pinch their nose or anything like that. So I mean, those are some basic things. Some other basic things that a lot of people don't think about that count as medical equipment and for preparedness, but they're essential to have. First thing here is your pen. Why is a pen essential? Well, you got to write down information. So again, if we're not in a grid down situation, if we're in just a natural disaster situation like Hurricane Katrina, let's say you have first aid experience and you help people get out of, let's say out of the water, they've been electrocuted, or they have deep cuts, or just some various nature of medical emergencies. You need to write down information, because if you're going an hour, 2 hours to a hospital in a situation like that, you need to be able to write things down. A lot of people write on their hands. So in my professional capacity, when I've had to deal with medical emergencies, the things I'm writing down is, when I'm trained to do it, so I'm acting within the scope of my training, is what their pulse was, what their breathing rate was, what time we took all that information. If you're talking about diabetics, it's kind of important to know what time they took their glucose or insulin or insulin or whatever they're taking. The diabetic thing, not really familiar with it, and familiar with it to a point where it's covered on the first aid scope, but don't practice it. So again, the time you put on the tourniquets as well, and basically just any other important information that would help someone, like help a doctor. So if someone's not really coherent, if they can't tell you the day, the year, the time, sometimes time doesn't matter because it gets away from people. That may not be a qualifying thing, but if they don't know where they are, they don't know what day it is. If you ask them other questions like who the president of the United States is, the time of year, they can't answer those types of questions. They might have some kind of traumatic brain injury, or they may have Alzheimer's, dementia, or something. But it's information that's important for a doctor to know about when they're, giving treatment plans and trying to save someone's life. So having a stockpile on this type of stuff and getting training on it isn't the worst thing in the world. It's a good idea to do. CPR and first aid are things that require about a 2-year to 1-year recertification, all depending on the agency and depending on the way they instruct it as well. So, but basic common household things, Band-Aids, antibiotic ointment, CPR mask can be that. Oh, and there is one more thing. Your watch too, so you know what time it is. A lot of people carry these digital watches. In a grid down situation, you're not going to be able to use a digital watch. Maybe you can if it's charged, but using the regular hands, the dial watches, and then having the the third hand, the ticking hand, is important if you're measuring pulse, breathing rate, all that type of information. But also, you get to look and see, okay, let's say you discovered someone at 2 o'clock in the afternoon with a deep cut or a deep laceration in their arm. You tourniquet off, you write down that it's 2:15 that you put it on, and you check to see what time it is when you get to the hospital, so you can say, okay, it was 2 hours ago or whatever. It's basic things that people don't think about every day. Pen, cell phones, good when that's not grid down. But these are just some of the basic things that I use, that I keep. And it's not necessarily limited to the scope of what's in my toolbox. There are household things that we do keep, like hydrogen peroxide that's good for keeping cuts clean and from getting infected. All those different types of things. We're not talking just complete like holistic or whatever. This is just basic to stabilize someone or to make or save their life. So, medical preparedness in the prepping community, I think, is vital. We're not just talking about stockpiling food or whatever. We're talking about dealing with situations where if someone gets common injuries, are we able to take care of ourselves? If someone goes down and needs CPR, are we able to handle that? Do we have the equipment at home to handle these basic emergencies? That some people should be thinking about. And again, is this situation going to happen? More likely, probably not, but it's important to be prepared for that. That's the whole term of prepping. And the thing with bandages and all these different types of things is everything has an expiration date. So you always want to be careful of those expiration dates, especially if you use things like a quick clotting gauze pad, because they're not as effective if they're expired. So it's better to have them, but you always want to make sure that you keep a good stock of things. So that's really going to do it for this medical preparedness information, if you want to call it that. So basically, get your CPR and first aid training. And remember, you got to be careful about what you do. You have to stay within the scope of that training. In a grid down situation where it's total anarchy and there's no government or whatever, it's probably a different story. I can't answer for that. I also can't give advice on that, but you have to act within the scope of what you're trained to do. There are laws for that. I mean, Good Samaritan laws may not cover you for everything. That's all dependent on state. But you get your training, you get stocked up on equipment, get a basic first aid kit for like $20, $30 from Amazon. Throw it in your car or have it in your house. It's always good to have extra bandages around anyway, but it gives you extra things like a blanket for burn victims. It gives you the ability to really like clean wounds and all that, and to pack wounds if it gets to that point. So you just want to get those skills, you want to get the equipment, and you always want to consider what other household items are not on the list, like a belt, a pen, a watch, that should be involved with your daily medical preparation. And really, not everybody checks their medical equipment every day, but if you do an inventory once a month at this point in the game, it's a good idea, I think. So it's going to do it for this episode. This is Hillside Prepper 552, and we'll catch you guys on the next one.